Thank you for tuning in to Global Elite Academy. If you would like to start your own non medical home care agency, please go to globaleliteacademy.net. That's globaleliteacademy.net. We have a do it yourself course, and then we also have a one-on-one course. The one-on-one course is that you'll be going to class, and we just help you through the procedure, and it'll be one person working with you. We help you get it set up and running, and help you get your license or whatever it is you need. The do-it-yourself, if there's a course and you just follow the instructions, follow the course, do the quizzes, and then when you're finished with the program, we'll give you your policy and procedure manuals for your state and the policy and procedure manual for IHSS. So again, go to globaleliteacademy.net. Now, today we're going to talk about getting your license in New Mexico. Oh, no, I'm sorry, not New Mexico. I'm sorry. We're going to do Boston, Massachusetts. Now, in Boston, they do not, for a non-medical home health agency, they do not require for you to be licensed. But for the IHSS program, you have to also get the Medicaid, Medicare program. So in Boston, you can't just go through the process and get certified for the IHSS alone. Like I was telling you last week, or the last week before last, that for Colorado, you could just get your non-medical home health agency license, and then you would also get your IHSS license. Okay, but in Boston, in order to get your IHSS license, you have to also get your license for Medicaid, Medicare provider. So you would be a Medicaid, Medicare provider. So you would have to apply for both licenses. You could apply for it at the same time, or you could get the Medicaid, Medicare one first, and then you'll get the IHSS. But for the non-medical, the home health agency, that state in Boston, Massachusetts, is unregulated. So you do not have to get your license. I always still require or advise you to get a policy and procedure manual, because you still would need that. Just because it's unregulated, you still need the policy and procedure manual for your company. And then you would also get the policy and procedure manual for IHSS. Somebody asked me, why do they need a policy and procedure manual if it's not regulated, if the state doesn't require it? Because let's say your employees a call, they have an incident on the job and they need to fill out an incident report. They don't even know what to do if you don't have a policy and procedure manual. If you have a policy and procedure manual, they can come into the office and look up that policy, and it'll have right there what to do. All the steps to take to fill out the incident report. Or if you want to have vacation. When can you take your first vacation? All they have to do is look it up in the policy procedure manual, and it's in there. Even if you forget, there's a lot of rules. You're running a company. You have to have these procedures written down. So they're also good for you as an owner. When somebody calls and say, "Oh, is there a certain amount is there certain days I need to get in the incident report?" Let's just say you forgot. But if it's written down, there it is right there. You need to fill out an incident report within 24 hours of the incident happening. So it's a book. Actually, the policy and procedure manual is a manual that helps you be able to run your business more professionally. And in the policy and procedure manuals is all type of forms in there, vacation forms, leave of absence forms, things like that. That all you have to do is take them out, copy them, and give them to the employee. So it's just professional. Whether the state regulates your business or not, you still need to operate your business in a professional manner. So you will still need the policy and the procedure manual. Okay? Um, okay, so so for Boston, Massachusetts, again, you do not need a license. It's an unregulated state, but um, you do need to get licensed for the IHSS program. Now, in Boston, it's not called IHSS. They call it Mass Health. That's what it's called in Boston. Mass Health. So if you're in a city and you don't know what it's called in your city, in your state, you could just go to Google and type in, like for instance, if you want to know if Florida have it, you would just type in, does Florida have the IHSS program? And what is it called? Or you could just type in, what is IHSS called in Florida? And then it'll tell you what it's called in that area, because it's not called IHSS in every state. Some states it's called, something different. So you would really need to Google it to look it up to see exactly what it is. But in Boston, Massachusetts, it's called Mass Health. And like I said before, it's an unregulated state, so you do not need the license, non-medical license. But you do, if you're going to take IHSS patients, you do need to get your certification for that. And you also need to have your certification for Medicaid, Medicare patients. So you need to get both certifications. Okay. So now, because the state is not regulated, you don't have to wait for those licenses to come back before you start, taking patients. Because if it's an unregulated state and you don't need license to operate the non-medical home health agency, that means that you could still take private pay patients and patients that have long-term insurance. So you can still, set up your company. If you're going to run it from your home, or you're going to run it from an office, it doesn't matter because it's non-regulated. So you can run it from your home and your office, a home or a physical office, So you can set up your office and start taking patients while you are waiting for your certification to come back for the IHSS program and for Medicaid, Medicare program. So you could, still be taking patients while you're waiting. Or you can you could open up your agency, start taking patients, and then apply for the IHSS later. Or you could apply for it right away. It really doesn't take that long to get. I don't like to give an approximate time because every state is different, and it really depends on how busy they are. But I know I have done some in Colorado that only took like 3 months to come back. Or I think the longest I did was like 4.5 months. So it just depends, like I said, how busy they are. Yes, for you to, but you still could be making money in the meantime by setting up your agency, okay? And remember, if you need help setting up your agency, if you want to take our do-it-yourself course, you can contact us. If you want to help doing it, If you want one-on-one guidance to set up your agency, we can also help you with that too. So you would go to globaleliteacademy.net. That's globaleliteacademy.net. Now, I think everybody knows, or I'm not sure, so I better tell you that you need an EIN number to operate a business. And you could go to irs.gov and you can apply online. Um, just look up your EIN number and it'll tell you, give you the link. And then you just apply online for your EIN number. Now, after you get through filling out the application online, they'll give you the number right there. So be ready to copy it down or save the form, because they'll just show you right there what your EIN number is. That EIN number is like your business social security number. So you want to keep that in a safe place because you'll use that to file your taxes and like that, or if you apply for credit with your company, a credit card or something like that, you'll need that EIN number because it's the same. Like I said, you use your credit card to get credit. You use your social security number to get credit. And for your business, you use the EIN number to get credit. And then you have to think of what structure do you want your business open. Do you want to open a sole proprietor, LLC, or a corporation? I like the corporation because I like to give stock. I have a corporation, so if I want to give my grandkids, part of that, like some stock and ownership in it, I can do that. Also, it's easier to raise money because if you need to raise money, then only thing you could just give out some shares to your company to raise money. And if I wanted to take my company public, where it's on the stock market, you could do that as well and sell stock to the public. So I really like the corporation. Also, nobody can sue you directly when you have a corporation. You're shielded from that. They can sue your company, but not you. A sole proprietor, they can sue you. An LLC, they can't sue you either. But an LLC, you can't give out stock, and it's harder to raise money with an LLC. So you have to think of what's going to be best for you, and then that's how you would open up your business. If you're going to have your business in your home, I would suggest that you get a virtual address. Boston, you don't need to have several different locations, so you can have one location in Boston. Let's say you're going to do it from your home, and then you would just sign up for a virtual address, and that's where your mail and everything would go. That's the business address you would use for your business, so that it's not the same as your home. And then you already know, I guess, that you would do you have to use a business phone. Get a business number. You don't want to use your cell phone. For my business number, I like Grasshopper because it's an auto attendant. When somebody calls, you can set it up where it say press 1 for this, press 2 for nursing, press 3 for human resources, things like that. So I like that. So Grasshopper is a really good company for that. So it's very easy to open a non-medical home health agency in Boston, Massachusetts. Next week, we will choose another state where you can apply and give you the rules and regulations to that state. Thank you so much for tuning in to Global Elite Academy. Have a good week.